We've just heard news that we will move from extreme risk to high risk in Clackamas County. Today, we will discuss what that means and how we need to continue to keep ourselves and our community safe. We'll also answer your questions about the vaccine. And joining us today is our public health officer, Dr. Sarah President. Welcome, Doctor.
Hi, thank you, Kimberly. It's nice to be here.
So this Friday, we're moving from extreme risk to high risk. And this means a lot of businesses will be able to open with fewer restrictions, such as we'll be able to dine in person. Some indoor entertainment is opening up. So what does that mean for residents and businesses in Clackamas County? And why do we need to continue to keep our safe COVID-19 practices up?
Excellent questions. Thank you, Kimberly. We have all been really patiently waiting for this time when restrictions can finally be lessened and we're able to enjoy what restaurants and other businesses have to offer with still having capacity limitations in order to stay as safe as possible. I want to say thank you to everyone in Clackamas County who has worn their face coverings, limited their gatherings, and worked so hard to keep yourselves and others safe. The move from extreme risk to high risk is a really big step, but it's definitely not the final step. County risk levels are assessed and reassigned as necessary every 2 weeks, which means if our cases increase again, we can quickly go back into that extreme risk category when things would need to close back down. So keeping up with your practices of social distancing, wearing your face coverings, limiting your gatherings, and other safe COVID-19 practices are essential for continuing to reduce cases and continuing to get back to some sense of normalcy.
Well, thank you for that. We definitely do not want to yo-yo back between high risk and extreme risk. And we want to keep moving forward and, enjoying what those businesses do have to offer that can reopen. We also know that the vaccine is really pivotal in slowing the spread of COVID-19. People who are over 80 are eligible now to receive the vaccine, and other age groups will be eligible starting next week. However, although people are eligible, it's taking a while for them to get their vaccine. So why is it taking so long?
Yes, thank you for that question too. So yes, those in phase 1A, educators and people aged 80 and over are currently eligible for vaccine. Next week, people aged 75 and over will be eligible for vaccine. And those eligible will continue to increase on a weekly basis based on the state of Oregon and the governor's office prioritization schedules. However, we do not have enough vaccine doses to vaccinate everybody who is eligible. We need to be really clear that eligibility does not equal availability. So we in Clackamas County have partnerships, we have workforce, we have ability to provide vaccine to the vast majority of people who are eligible at this point, but we don't have the actual vaccine to give to people. Currently, the demand outweighs our supply from the federal government of vaccine. If you look at our current rate of vaccine allocation and administration, we would suggest about 3/4 of older adults and those who are currently eligible would be able to receive at least the first dose of their vaccine by early April. So those are the people who are currently eligible. And like I said, the eligibility will continue to increase. These timelines are constantly being reevaluated based on vaccine supply from the federal government. While I know that this is frustrating, we continue to ask you to be patient as we work together through this. We're dedicated to making vaccine available as soon as we can once we have enough vaccine to get around to the people who need it.
So for many of us, it's months, not weeks, before we will receive our vaccine.
Yes, that is the way it is looking at this point.
Okay, that's important to remember. So what are the plans for people who are homebound and unable to travel to vaccination sites, such as the ones happening in the Portland area?
For people who are not able to leave their homes, we do have programs in partnership with a number of organizations and pharmacies and our own public health nurses that are making arrangements to get vaccines to those high-risk populations. Homebound individuals who have already been identified have been contacted by our public health team. And if you have not, if you are eligible for vaccine and unable to leave your home to go get vaccine in one of these mass mass vaccination sites, we ask that you email us.
So how can people schedule getting a vaccine?
For those who are eligible, you can go on the Oregon Health Authority website, which is covidvaccine.oregon.gov, where you can determine if you're eligible and then try to schedule an appointment online. These appointments are for the Oregon Convention Center, as well as other vaccination sites that are available. Right now, there are not any walk-up mass vaccination sites. They are all by appointment only. So please be patient. There's not enough vaccine available to vaccinate everybody who's eligible. So there also aren't many slots open for appointments. We all need to continue to be patient as we wait for more vaccine.
To get more information about the vaccine, you can visit us at our website. Please remember, although you may be eligible for the vaccine, it could be months before you get it, and we apologize for that. If you are a homebound individual and you do not have arrangements to get the vaccine and you're currently eligible to receive the vaccine, please email us at covidvaccine@clackamas.us. Thank you very much for everything that you have been doing to keep your community safe from COVID-19, and that moved us from extreme risk to high risk. Please keep up the good work and don't stop now. Stay safe, and we'll see you next week.